Hi guys, this is Puja and Wahidah with student number 231101605A from Department of Health Policy and Administration class of 2023. In this video, I would like to answering 7 questions to ponder related to quality management. So, are you ready? Let's go! So, transformation process is a series of activities that converts inputs into outputs that provide value to the customers. In quality management, every organization operates through a process approach consisting the inputs, the processes, and the outputs. For example, in hospital, the inputs include the patients, the healthcare workers, the medical equipment, and also the information. Then, these inputs go through some processes like clinical and administrative, resulting the outputs such as diagnosis, treatment, recovery, and also patient satisfaction. Therefore, quality is not determined by the only final result, but how effectively the entire process transforms into the desired outcomes by our customers. Process performance can be described by measuring quality characteristics that reflect how well the process meets the customer's requirements and the organizational standards. In healthcare, these characteristics may include accuracy, reliability, safety, efficiency, and patient satisfaction. For example, in a hospital may evaluate the process performance through indicators such as waiting time, infection rates, the medication errors, patient satisfaction scores, etc., etc. And also, one of the most important thing is average length of stay. If patients receive safe and timely care with minimal errors, the process is considered to be performing well. This quality characteristic help organizations determine whether their process consistently meet the expectations of the customers and also the organizational. So, common cause variation is normal variation that exists in every process. But the special cause variation comes from the unusual events such as the equipment failure or the human error. A process is in control when special causes are removed. And a capable is one of that consistently meet the customer requirements. So these both tools are used to monitor the process performance over time. A run diagram shows the patterns and also the trends, while a control chart shows the control limits to identify the unusual variations. Control charts provide the stronger evidence for improvement and decision. So by that, both of them are very, very important to controlling and then for the evaluation at the end of the process. So why we use 2 charts? It's because in variable control charting, 2 charts are used because they measure different aspects of process performance. The X-bar chart monitors the average value of the process, while the range chart monitors variability within the process. Looking only at the average can be misleading because a process may maintain the same average while becoming more inconsistent. By using both charts together, managers can evaluate both the stability and the consistency of the process itself. So, inspection alone does not guarantee quality because it focusing on detecting the defects after they have already occurred. Quality should be built into the process rather than the inspected into the product or service. For example, inspecting medical records may reveal the documentation errors. but it does not prevent those errors from happening again. So modern quality management emphasizes the prevention, continuous improvement, and also the process control. Therefore, the inspection is useful for identifying problems because it is, you can use the inspection to at least know what you're going to do, but it is not sufficient to achieve the high quality on its own. So this last question has a good sentence at first, while it's saying that quality is as good as the data is. And how do the variables data differ from the attribute data? So the first statement means that quality improvement depends on accurate and reliable data. Poor quality data, or somehow it can be misleading or misunderstatement, or also the wrong data, could lead into incorrect conclusions and ineffective decisions, because organization use the data for the monitoring the performance, the identify problems, and also the evaluate the improvement efforts. There are two main types of quality data. Variables data are numerical measurements that can take any value within a range, such as waiting time, blood pressure, and also the average length of stay. Attributes data, on the other hand, classify the observation into categories such as satisfactory or unsatisfactory, like satisfied or unsatisfied, compliant or non-compliant, and defect or not defect. But both of types of the data are very, very important. We can use both of them, but they provide a different perspective on quality performance. So that's all for my answers. I hope it can be satisfied and also meet the expectations that I am looking for, and also all of you are looking for. And I apologize for any false statement, for any misleading statement, because I'm a student, I'm still learning, and still have more things to discover. And thank you so much, first of all, as well, to my teacher, to my lecturer, Ibu Sumarni SKMM Kesmars, that have been taught us so many things related to the quality management and give us so many the big picture of the management and the healthcare facility. So I'll see you guys in the next video. So bye bye.